everyone. Welcome back to Better Day Podcast. My name is Katrina Chase, and we are here today with a wonderful guest. I have Leslie here, of course, with me.
Hello, everyone.
Anthony's back behind. And I have Amanda here with me.
Hello.
So Amanda I've known for about 4 years, and I asked her here today to talk about her testimonial regarding her recovery for her mental health and history with drug and alcohol use. Now, before we get into that, last week we talked about the sensitive yet important topic of suicide awareness and prevention and mental health. If you did not listen to that, I suggest you go back and listen to that last podcast. So, Amanda, thank you for being here today.
Of course.
And can you tell me a little bit about yourself? Tell the listeners a little bit about you, how we met 4 years ago.
4 years ago, I came into recovery unwillingly, and I met Katrina at Roots to Recovery. I, needed some guidance in my life, and things have just gotten so much better since. Now my life has changed drastically. I have a young son who is amazing.
Mm-hmm. He really is adorable.
Mm-hmm.
You have a husband now too, right?
Yep, married too.
How long have you been married for?
2 years now.
And how old is your son?
He is 1 now.
Time
13 months.
Flies.
So crazy.
Time flies. Can you describe in your own words for you your earlier stages of your recovery and mental health, and if it was it different?
Yes. My whole outlook on life was very different. I didn't really care too much about anything, including myself, or anybody in that matter. My whole goal in life was to continue on that downward spiral. I had gotten to a point where I felt like things in my life were just too bad that they couldn't get any better. Right. And I just figured if I kept going down that path, I would end up happier. I don't know what logic I was trying to figure out, but I was definitely lost and confused and very depressed, and trying to figure out a way to, I guess, get through it, but was definitely losing that battle.
Yeah. What do you think your turning point was?
I would have to say really my husband.
Really?
My family, unfortunately, I had put them through too much that they kind of had to step back. But my husband, at the time, he had gotten sober before me. And seeing him do that, being with him for a while previously, and then seeing his life change for the better, and him basically giving me no other option but to do that for myself. And slowly things got better. Things in my life. I gained a job. I gained respect for myself and respect from others. And, I just gained happiness and a better outlook on everything. And my family was back in my life, and it gave me a purpose again. I guess I was really looking for something to strive for in life.
Wow.
It's beautiful.
No, thank you. Thank you for being here, Amanda. Welcome. I have a question. How long did you struggle with addiction before you started your healing journey?
I started using drugs and alcohol at a young age, maybe in my early teens. It started with drinking, and then it turned into heavier drugs and along with other things.
How do you think your mental health took a toll on that?
Well, just living that lifestyle every day, it really took a toll on my mental health. I wasn't feeling great. My depression really kicked in. I was extremely anxious all the time, always trying to figure out how to get by, get that next high. And the anxiety and depression just got so bad, and life just really, it wasn't worth living in that state.
Right. In your early recovery, this last time, how was your mental health? How was healing your mental health compared to healing yourself from the drugs and alcohol?
So the drugs and alcohol weren't extremely difficult to heal from. It takes time to get rid of that sickness, I guess. But the mental health and the recovery journey took a lot longer than I had thought. I thought definitely that, as soon as I stopped using and drinking and doing the bad things, that, instantly things would change and they would get better. And things didn't go that way exactly. They got better slowly, but it did take time and effort, and I had to work towards those things. Go to meetings, do the next right thing, kept trying to help others and be a good person, and, take the steps that I learned in recovery to move forward and just better myself.
What kind of support did you have?
Well,
And do you think how important do you think that is?
I think support is important. I think a sponsor is important to take you through those steps and definitely process those feelings and emotions. I think gaining support from your family and friends and having a couple good people that you can depend on is extremely important. To build those relationships with just a couple people that you can call your friends and that will be there for you all the time. Those are the supports that I have gained during my recovery that have really helped me out over time and have helped me learn more about myself and have helped me heal a lot.
That's beautiful. So in some of the other podcasts, Leslie and I were talking about, the specific steps that someone would take to get clean if they're, currently using. And I have discussed this before, that each of us are different. Not all of us take the same steps. You remember that, right, Leslie? So for you, what was it for you? What did it look like for you? And, I know for myself, it didn't happen the first time. So,
no.
Yeah. So what was that final route, that final routine look like that worked for you?
I really had no other options left. When I had gotten into recovery, I was facing some charges and, dealing with a lot of consequences due to my actions. So staying clean and sober at first was definitely a must.
Right.
But as time went on, getting rid of all the consequences and luggage that I had been carrying around, it really created new experiences for myself because I was able to go on and better my life and create better opportunities for myself. I guess getting through, getting myself out of those bad times and getting into the recovery was probably one of the best things that I did with my life.
How do you think, or looking back, how do you feel, or what do you feel worked for you to get rid of that baggage? Or was it multiple things, multiple people, multiple support?
Multiple
therapy.
people, therapy, definitely. Just spending time with the women in recovery. All the people I've met I have met a lot of people because I do manage a recovery resident. So all the different clients I meet and all the different women in recovery have taught me so much, all their different experiences, and all the different things I've learned from them and gained, just has opened my eyes to so many other possibilities, and how much better, that we can make our lives if we take, just a couple steps to, put ourselves in the right direction, speak to the right people, put yourself in the right place, set yourself up with the right sponsors and people in your lives to take you on that journey to help you get better, I guess.
Yeah, completely. Your struggles specifically, what do you think the most difficult part was, acknowledging that you not only just had a problem, but you had no other option but to fix it? What was the most difficult struggle with that?
Well, I'd have to say the most difficult thing was just changing my whole life. I had to change everything about myself, the way I thought, the way I acted, the way I spoke, just everything. Everything I did, the way I dressed, just everything about me. I had to change everything about me so that my life could be worth something, I guess. Because everything that I was doing was not working for me. It wasn't getting me anywhere. It wasn't bettering myself. It wasn't bettering my family.
Right.
So
now you've got a few years underneath you, or you're about there. What do you, in your perspective, in your journey, could you tell us a little bit on like how your mental health evolved as you changed everything about you?
So my mental health has definitely evolved. I've definitely gained more confidence in myself. I feel stronger as a person. I have more self-esteem. I, put a lot more self-love in to the things I do, and I put a lot more care into my daily activities.
What does that look like?
Waking up every morning and showering, going to work,
More
feeding my son,
things we never did.
All the things that, I never did, that I lied in bed and expected other people to do for me that I have to do now, that everyone else does.
And how do you feel about doing those day-to-day activities now?
I like it. I look forward to it. Some days it's a struggle. Some days work stinks and people are mean and things don't go my way. But every day at the end of the day, I get to go home to my husband and my son who love me and care about me and depend on me. So that makes it all worthwhile.
Mm-hmm. And you are loved by so many.
Thank you.
You're welcome. How you've got such a long journey that you've been on.
Yep.
How do you stay so focused? Do you have a routine? Is there something,
Yeah, my routine's the same every day.
Yeah.
I don't veer off course at all. I get up every morning, Monday through Friday, go to work, unless I am deathly ill and I can't go. I come home every day, do the same things. I follow the same structure and routine. For the most part, I do things differently some days, but I try to follow the same structure and routine because I really don't know anything different at this point. And it's worked so far, so I don't want to change anything.
Don't try to fix something that's not broken.
Yeah, it's not broken, so it works.
So you mentioned about the emotional and support that you got from the group that is super important.
Mm-hmm.
What do you feel about stigma? Do you think that there's a lot of stigma in regards to addiction, in regards to recovery, and in regards to the people that are trying to, work on their journey, on their path to recovery?
Absolutely.
And Amanda, and I know that we've spoken about this before, like the medication assisted treatment, that M.A.T, the stigma around that.
Yep. So I feel like there is a huge stigma around people in recovery, especially when you refer to people on M.A.T programs and stuff. Even when, just in your day-to-day life, people label you. A lot of jobs you go to look for, they do a background check, and a lot of people who are in recovery have background, so that can be an issue too. A lot of the times people in recovery are dealing with a lot more day to day that people don't know about. So the stigma, people in recovery definitely feel that. They feel labeled at certain points, and can feel labeled by their family as well.
I think everything happens because there's not really an understanding what you guys are going through. And I've seen it, and it kind of hurts me too. I mean, I'm not in recovery, but we have an organization that tries to help people in recovery, and it's very detrimental sometimes how society see people. I mean, that could happen to anybody. That can potentially happen to anybody, and no one is exempt to go through a mental health challenge.
I agree.
And sometimes I hear people judge. I hear people just judge their book by its cover. And sometimes you don't even know what a person is going through, or what lead that person to get into that situation.
Exactly.
We are huge promoters of ACEs prevention and awareness. And ACEs, we've been speaking about ACEs since the first episode. We've been speaking about ACEs since we put together this organization back in 2018, before the pandemic started. And what is ACEs? It's adversity that happened that create trauma, adverse childhood experiences. And those experiences shape our behaviors and shape our risky behaviors to be vulnerable to opioid addiction, to drugs, to alcohol, to risky behaviors, to health outcomes, so many things. And no one can say, I think, in the world that they never experienced an emotional challenge. So therefore, I would like to ask the audience, ask the community to be more empathetic and more kind, because they don't know what you or other people are struggling with. And if we can help each other, it will be a much better community for everybody. And especially those people that are struggling every day with this illness, which is addiction. It's not easy. I've seen people, I try to always be there. And me as a friend, even as a friend giving the support, it breaks my heart what you guys have to go through just to overcome the struggles with the addiction, with the illness on its own. And yet, on top of that, we have people in the community that label you or make you feel uncomfortable or make you feel like you're not normal. It's heartbreaking. So I would like to ask our audience to please, promote kindness, promote just goodness, and then try to understand a little the other person, because we don't know what other people are going through. And I thank you so much. And, you're doing amazing. I hear a lot about you from Katrina. You're a manager now. You have your own baby. I mean, as soon as you walked in, and you were like so bubbling, happy, and so happy to speak about your baby, which is a purpose in life, and then your structure. You're doing amazing.
You really
and you should be proud of yourself and shouldn't let anybody ever put you down. Even for me, I don't have an addiction, but sometimes it's hard too. And I mentioned this before to Katrina. I do speak with an accent, and then people sometimes, I wouldn't like to label anybody, but sometimes people are not that kind, and they think that because immigrants or whoever, they speak with an accent, they think with an accent. And I mean, they don't know. I mean, I'm bilingual. I speak more than 2 languages. They don't know. I don't like to brag. But, you know, it's just about kindness. It's about kindness. And this is what we're trying to promote, kindness. And I appreciate your journey. Kudos to you. And anything that you need, we're here to support you.
Absolutely.
Thank you.
Absolutely.
Thank you.
Well, Amanda, I have one more question for you. It's a very important question. What message would you give everyone who's listening that is afraid to reach out, that's struggling right now, and whether it's due to stigma, fear of judgment, or just don't know where to reach?
So if you're afraid to reach out, honestly, there's probably been someone in your same exact situation, feeling the same way, that has reached out and has gotten better. There are people out there that are willing to help you, that are willing to take the journey with you and go through the process. So if you're struggling, there are people that are kind and willing to be there and go with you on this journey. So reach out. It will be worth your while.
Thank you. I definitely know that you can reach out to me. My cell phone's 561-777-0045.
Mine is for the Better Day Foundation is 954-297-9802. And before we wrap it up, I want to speak about the medication-assisted treatment, Katrina, that you with Soft-Flow Recovery are going to start a program.
Yes.
And I think there's a lot of misinformation about it because for what it is medication-assisted treatment, and it requires a whole, you know,
An
a
entire
comprehensive
team.
approach, not only by the provider, but also by the recovery homes and the family, the client or patient. So it's a team effort. And if anybody has any questions about that, please reach out to Katrina. She'll be able to guide you and also link you to the care that you need when it comes to medication-assisted treatment, and provide you educated information with psychiatrists, with therapists, that you can make an educated decision.
Absolutely. We have a whole team, peer counselors, support within the team, support within the community.
And you offer free case management. So if
Yes.
anybody's struggling, please reach out. Help is here, and we're here to support you. And a stigma-free zone.
There's no judgment whatsoever.
Thank you, Amanda.
Well, thank you, Amanda, for coming on here and joining us.
Thank you guys for having me.
You're welcome, and I love you.
Thank you, Anthony, for doing this again with us, even though you were very quiet.
Very quiet today. Okay, thank you, everyone, and until next time.